Hi, so we're going to talk about arterial blood gas interpretation today. Our goals and objectives today is to define what an arterial gas is, how to identify normal gas levels, and how to properly and correctly interpret an arterial blood gas. So what is an arterial blood gas? An arterial blood gas is pretty much a blood test that we use to measure a patient's acid-base imbalance. It also gives us information about a patient's oxygen and carbon dioxide levels. This test is usually done by a respiratory therapist, a doctor, or a registered nurse. So some of the results you might see in an arterial blood gas are respiratory and metabolic acidosis, respiratory and metabolic alkalosis. So first we're going to talk about respiratory acidosis. Respiratory acidosis is a condition in which your pH level is decreased due to hypoventilation, as in the patient is not taking enough deep breaths. So these are the patients that you see that can't catch their breath. They're not breathing, enough. They're breathing too slow. This is some of the causes of respiratory acidosis: is CNS depression from drugs, injury, or disease, hypoventilation due to pulmonary, cardiac, musculoskeletal, or neuromuscular disease. Some of the signs and symptoms you should look out for is diaphoresis, headache, tachycardia. They're confused because they're not getting enough oxygen, they're restless, and sometimes apprehensive. Respiratory alkalosis, on the other hand, is when the patient has too much pH because they're hyperventilating, as in they're breathing too fast. You see this in a lot of patients who are very anxious or in a lot of pain. Some of the causes can be respiratory stimulation caused by drugs, hypoxia, fever, or even high temperature. There are some gram-negative bacteria that can also cause this if it goes into your blood. Some of the signs and symptoms you will normally see: they're twitching, they're anxious, they have fear in their eyes, they get numb, the finger starts tingling and become very numb. These patients also take really rapid, deep breathing. And next is metabolic acidosis. So this is when the patient has too low of bicarb levels. And your kidneys is usually in charge of this. So this acid-base imbalance can happen when there's a depletion due to renal disease, diarrhea, or small bowel fistulas. Also, when a patient produces excessive amount of organic acids because their liver is not working, this can happen as well. Some endocrine disorders like diabetes, mellitus, hypoxia, shock, and drug intoxication can also lead to metabolic acidosis. Some signs and symptoms you should look out for are fatigue, fruity breath, drowsiness, nausea, vomiting, rapid deep breathing, they become very fatigued as well. Metabolic alkalosis is when the serum bicarb level is too high. And this can usually can happen because your body is inadequately excreting acids due to renal disease. You lose a lot of hydrochloric acid from prolonged vomiting or gastric suctioning. And also it can be caused by low potassium levels due to increased renal excretion, like when we give patients diuretics to help them lose a lot of water, and steroid overdose can also cause this. Some of the symptoms that you will see in the patients, usually they're irritable, they're also confused, they can go into a seizure, they have slow, shallow breathing, they can become very confused as well, and they also twitch a lot. So now we're going to talk about how you can interpret these abnormal balances. So the first thing you need to know what a normal arterial blood gas figures are in a healthy patient. So in a healthy patient, this is your normal pH, this is your normal oxygen level, this is your normal CO2 level, and your normal bicarbonate levels. So the mnemonic that I want you to remember is ROM. The RO stands for respiratory opposite. The ME stands for metabolic equal. So a patient is acidotic if their pH is less than 7.35. They're alkalotic if their pH is greater than 7.45. This is going to be really important when it comes to interpreting the blood gases. So there's only 2 steps to interpreting ABGs. Your first step is to determine if the patient is acidotic or alkalotic. If the patient is acidotic, their pH will be less than 7.35. If they're alkalotic, their pH will be greater than 7.45. So once you figure that out, you go to the next step, which is to figure out if this acidosis or alkalosis is due to a respiratory or a metabolic issue. You can determine this by looking at the direction in which the pH and the CO2 are moving in. If it's a respiratory issue, the pH and the CO2 levels are going to be moving in opposite directions, which means either the pH is going to be going up and the CO2 is going to go down, or the pH is going to be going down and the CO2 is going to be going up. So they're going to be moving in separate opposite directions. It is a metabolic issue if both the pH and the CO2 numbers are moving in equal directions. They're both either going down or they're both going up. So we're going to try an example. So you drew a blood gas and the lab called and gave you these results. So is the patient in, which acid-base balance would you think the patient is in? So the first step, that we said previously is to determine if the patient is acidotic or alkalotic. And in order to determine that, you look at the pH level. The pH level right now for this patient is 7.30. And according to our normal levels, anything below 7.35 is acidotic. And since this patient is below 7.35, we know that they're in acidosis. So we got that part down. So we know it's an acidosis problem. So we can all eliminate these two choices. So now we have to determine, is it a respiratory issue or a metabolic issue? So in order to determine that, we're going to look at the direction in which the CO2 and the pH are moving in. So we already determined in the first step that the pH is going down because it's below 7.35. So now we have to see which direction is the CO2 going in. Is it up or down? And based on this normal level, anything greater than 45 is going up. Anything greater than 45 is going up. So we know that, and this is 50, which is greater than 45. So we know the CO2 is going up and the pH is going down. So they're both going in opposite direction. So as a result, respiratory opposite. So we know it's a respiratory issue. So we know this patient is in respiratory acidosis. That's the answer. So now that you know how to do, we're going to do two case studies together. I want you to take the time to read this case study, pause the video, and then try to figure out yourself before I go over it. All right, so you had some time to read the case study. So based on these numbers, how would you interpret this? So we know the pH is 7.30. So is it low or high? It's less than 7.35, so we know it's low. So if it's low, it's acidosis. So we know so far the patient is acidotic. Now we're looking at the CO2. CO2 is 68. Right? So let's see what's a normal CO2 level. A normal CO2 level is 35 to 45. This patient had 68. So we know that it's going up. And we know this is going down. So this is down and this is going up. So is this opposite or equal? It's opposite. And based on our Rome mnemonic, respiratory opposite. So we know that this patient is respiratory acidosis. Okay, and also just based on the information you get, you can also determine this imbalance by looking at the information given in the case study. If you know some of the symptoms of each acid-base imbalance, you can make a very good educated guess on which one they're in, and you can use this the numbers to confirm your diagnosis. So this is the next case study. I want you to also pause this, read it over, and try to come up with your own answer before I go over it with you. All right, so Carl, you had the chance to read about Carl here. So based on this level, the pH is 7.0. So we know that the patient's is acidotic because it's less than 7.35. Now we look at the CO2. The CO2 is 23, and from previous slides, we know normal CO2 is 35 to 45. So this is lower than 35, so it's going down. So based on our mnemonic, this is going down, the pH is down, the CO2 is down. Are they both going in the same or opposite direction? They're both going in the same direction. They're both going down. So this is a metabolic equal. So we know that this is a metabolic issue. And based on this number here, we know it's acidosis. So Carl here is a metabolic acidosis. If you got it right, good job. So for those of you that did not understand my method, there's also another method of interpreting gases, and this is it's called the tic-tac-toe method. I have a link here for you to check it out. If you have more questions, this will be able to answer that for you, and it's a great way to learn a new way of doing this. So the next step for you is to get together with another student, or you can do by yourself and answer the rest of the case studies, which is on the next 2 slides. When you do this case study, I want you to include the signs and symptoms and possible treatment. I did talk about some of the signs and symptoms in the slide. I didn't go over the possible treatment, but that's because I want you guys to look that up for yourself, because we will be going over that next week. So I want you to get a little ahead and just start taking a look at that information. And that is it for today.